Hi, welcome to Powell Clinic. Thank you for joining once again. Today I'm going to show you how to set up for a squat. Most of us have been given the instruction to step with our feet hip-width distance apart and our toes pointing forward. And for some people that works out great, but for some people, me included, that doesn't work out very well. And it doesn't mean that there's a lack of strength, it just means we have to adapt the position to the width of our pelvis. So what happens when a person with a slightly wider pelvis aligns with their feet hip-width distance apart and the toes pointing forward is that as we lower into the squat, the knees collapse. And that simply has to do with the orientation of the pelvis. So if you imagine the pelvis or the wing of the hip, the cave-like structure, the acetabulum, for a person with a more narrow pelvis, the acetabulum faces a little bit more forward, which means that the head of the femur comes more forward like this, and therefore the knee is pointing right towards the front. That's their natural alignment. That's how their pelvis is. For a person with a wider pelvis, that acetabulum simply faces a little bit more out to the side, which means the femur has to come more from a lateral angle to attach itself, which will naturally make the knee point out a little bit more. So we have to honor that in order to successfully set up for a squat and perform the squat. Here's what I mean. If you want to know what the correct setup for you is, start by setting up the usual way with your feet hip-width distance apart and your toes pointing forward. Now, start to squat and see what your knees do. My knees, especially the left one, collapsed a little bit more. It came in towards the right knee. Now, I've been doing squats for quite some time, so I know that that setup is not the correct one for me. So, if that happened to you, shake out your legs, step from one foot to the other, and simply let your feet and your legs come to a position that is natural to them. And for me, it's about there. Now you'll notice that my toes aren't pointing straight forward, and I'm not hip-width distance apart. I have a little bit of an angle. This is the visual to that acetabulum facing more this way, and the femur having to kind of rotate a little bit to make the joint up here. This way, my knees are aligned in the angle that that femur made the joint up here with the hip. So from here, I can go ahead and squat, and that's a more natural stance for me. So now that you've found the position that works for you, now we're going to go into the actual squat. So as you lower your knees, you want to make sure that those knees align themselves over the second and third toes. That's your cue. You also need to keep your knees behind your toes, because if you squat forward ahead of your toes, you are going to put an enormous amount of pressure on those knees and risk injury. So find a stance that works for you, bend a little bit, keep your knees aligned over your second and third toes, and only lower as far as it's comfortable for your knees and for your back. Make sure that you keep a flat, neutral back. To come up, you push through the heels to engage your glutes, and you sit up. So find your stance, start to lower, keep your knees aligned over your second and third toes, go as slow as you can without compromising the integrity of your spine, engage the glutes, press into the heels, and sit back up. So there you have it, how to more properly align for a squat that works for you, and how to do the squat. On the next video, I'm going to show you how to advance the squat, so how to use external resistance to make it just a little bit harder. So I hope you can join us for that. Thank you for joining us for this video. Talk to you later.